Hi, my name is June Hertzler, and this is Maggie, my rescue pup. I adopted her, and it turns out she rescued me. I work at Dean Human Resources, and in my spare time, Maggie and I volunteer as a pet therapy team at St. Mary's Hospital in Madison, Wisconsin. My volunteer story actually starts with Maggie. She came into my life at a time when I was trying to figure out how to move forward. I had just lost my mother after caring for her for 14 years in my home. Her death was followed by the sudden loss of our dog, Abby, 2 weeks later. A friend and coworker who volunteered with a rescue group thought it would be good for me to busy myself helping dogs that needed someone. At my very first meet and greet, which is a time where prospective adopters come to meet dogs to see if they would fit into their family, Maggie came into the rescue. I remember that morning very clearly. I had a talk with God in the car on my way there. I felt the need to tell him why I was not ready for a dog in my life. An hour into the event, there she was. I immediately started putting up roadblocks in my mind, really good and valid reasons why I couldn't adopt this dog. That night, I received a call from my coworker. She told me that people had heard of my recent losses and they had offered donations, enough to cover her entire adoption fee. I began to recall my morning daily prayer. Lord, please show me the way. Help me to be open to what you have in store for me. Allow me the wisdom to recognize the direction when you lay it out before me. I knew that God was working in my life, and days later, Maggie was in my home. She needed time to adjust, but it wasn't long before I knew she was a loving and gentle spirit. I thought she would make an amazing therapy pet. And I knew I wanted that to happen at St. Mary's Hospital because of the loving care both of my parents had received from St. Mary's and Dean during their illness and deaths. Maggie flew through the certification process. She was a star. And I slowly went through all the volunteer processes that you have to go through to be a volunteer. Maggie was quickly popular with patients and staff, patients of all ages. As we walk out onto the units, Maggie's here rings out for multiple staff members, and they have their own meet and greet time with Maggie and seem to appreciate and enjoy it just as much as the patients do. Maggie is especially good. I'm sorry, I can see that too. Maggie is especially good with those who are very sick, in a lot of pain, or dying. She seems to know who needs her most, and she's especially loving to those individuals, melting into their cuddles and hugs. It's extraordinary. One evening, we went to visit the pediatric unit, and we saw a woman pulling a wagon with a small child inside. He was leaning back into the wagon and had a bottle tucked under his arm. He looked rather lethargic, but when he saw us, he sat up and pointed to Maggie. She got right into the wagon with him. He held out both hands to her and reached out to hug her. She snuggled her little head right under his chin and put one paw on his shoulder. Even I couldn't believe what I was seeing. After a few seconds, the little boy let go and said, "Puppy." Eventually, he felt good enough to get out of the wagon, and his mother watched the little boy regain some energy and animation. With a tear in her eye, she looked at me and said, "This is the little boy I have been waiting to see again." A week or so later, Maggie and I went to visit an elderly patient and his wife. The man stated that he was unable to hold Maggie since he had surgery, and he was concerned that it would be too painful for him. I leaned over the bed so he could pet Maggie on the head and reach her comfortably. He grew misty eyes as he shared stories about the dogs they had had through the years. His wife sat quietly looking out the window with very little interaction with us, and it felt like she was struggling to hold in her emotions. After stroking Maggie's head and back and talking to her for some time, he looked at me and said, "They can't help me here. It's gone too far. I'll be going home tomorrow, and this is how it will end for me." He went on with a slight grin and said, "I was feeling sorry for myself when you came in, and I'll most likely return to it when you leave. But for this brief moment in time, this furball brought me a moment of happiness and relief." On another visit, we were directed to the room of a woman who was in a great deal of pain. Her care team had been working hard with her to assist her with pain management. They asked if we would be willing to stop by and spend some time with her. The door was open, so I knocked softly just to get her attention, and she quickly yelled out, "No, I don't want anyone to come in here." I looked down and said, "Come on, Maggie, let's let her rest." She said, "Wait a minute, what do you have there?" I picked up Maggie and I said, "This is Maggie, and we make rounds and come to visit people." Her face softened a little bit and she invited us in. She said she was in too much pain to hold Maggie, so I sat close to her and she pet her and talked to her. After several minutes, she said, "She's so little, I might be able to hold her." She did. I watched as her respirations became less labored. Her body relaxed, the tone of her voice lightened, the expression on her face softened, and at the end of our visit, she said, "I think I'm going to be able to get some much-needed rest. Maggie was the best medicine I've had since being admitted." The staff at St. Mary's is very good, not about just sending us to those who love dogs, but to those who need comfort, diversion, cheer, or escape. They are interested in how their patients are doing and how they react to Maggie's visits, and often stop by while we're there. They rejoice when their patients are uplifted. The compassion for those in their care is apparent, and it feels so good to support the work that they're doing there. I feel I get so much more than I give. Maggie has been a source of healing in my own life and for so many of the patients at St. Mary's. And as I tell them every time we visit, I'm just her ride. I bring her to the hospital, and once we're there, it's all Maggie. I'm blessed to be the conduit of that. And if I could afford to retire now, like win the lottery or something like that, I would selfishly be doing this every day. Words cannot express how grateful I am to be a part of the healthcare journey that these patients are on. I'm very grateful and very humbled for this honor. I thank Joanne Johnson, the Director of Volunteers at St. Mary's, and all of the staff there for allowing us to be a part of this wonderful experience. Thank you.